Everyone, I'm Marcin. Hi. Like you already heard, I have some experience in product management, and I was invited here to talk about one specific case about my experience in working in uPacjenta, where I was responsible for transforming the organization from service-based to product-based. And I would like to talk about how this went and what was my experience there. So, firstly, a very big disclaimer. It's not a success story, per se. It wasn't a success, I think, even, but it's a case study. So there was lots and lots of decisions, lots of ambiguity, and I think some lucky outcomes. And I would like to talk about how this came to be. So, please raise your hand, everyone who knows what uPacjenta is, or maybe use it. A few hands. And how many of you was forced in some way to draw a blood in the place like this? Also a few of them. So basically what uPacjenta is doing is a home-based blood drawing service. Because if you had this experience of blood draw in the collection point, like this one, you are finding yourself in the foreign place with artificial light, with strange smells, with foreign people you don't know, and it's really stressful inside. And if you have children, it's even more stressful for both of them and you. And this is a real pain in the ass for parents, especially. So what uPacjenta was doing, and they found this, the founders found this insight, that it's a better way to do it at home. So they devised the service that is a blood draw service at home, booked online. So how this looks like basically this is a website. You can put your address there. You are finding a specific test or package of tests you want. You took a specific date that you want, and at some point, someone came to your place to draw a blood, and it's really stress-free. So stress-free that even my younger daughter, 4-year-old, she didn't even notice that the blood was drawn. So this was something. It was incredible experience. And I remember that Konrad, one of the co-founders of uPacjenta, was my friend on LinkedIn, and I thought that I just sent him a message that this is really incredible. I didn't have similar experience in years with any kind of service, especially medical service, healthcare service like that. Something that is so different than I used to experience. And Konrad wrote me back that, you know what, we are actually looking for someone for the leadership role in the uPacjenta to transform this into scale up, into product-led organization. We just rise around, quite a big one for Polish startup scene, and maybe you would like to take part in this recruitment. So after the recruitment process, I found myself, I had her then into the part of the leadership of uPacjenta. With this specific mission of transforming the organization into product-led. And this was basically what PR note said. And I had this question, so what does it really mean? What I need to do? What is the goal there? So I had I needed to make this dive into the product and understand what I need to really do. And I started with discussion with my wife, who is like the service designer, and we had this long-standing argument about what is the difference between product and service. So I basically drew here this distinction between us, the rift between us, and something that we really are passionate about. Because for her, product is just a part of something bigger, something that user is experiencing on the whole customer journey, and the product is just an enabler, part of it, sometimes the most important part, but actual experience, the touch points, and the thinking about using the product and the value of it, it's drawn even before the product is used or even after it. And my approach was actually service is the part where you are proving something that is valuable for your clients. You're doing it manually, in this case by nurses or medical specialists, and at some point you need to start scaling it up using the like exponentially, and if you have to make it like successful, you need to have a bigger number of clients, rising number of clients, and revenue with the smaller amount of people who is supporting the business. Then you can grow exponentially. So you are taking this thing that works and scaling it up as a product, something that is not manual but can be automated, can grow faster than the rest of the organization. So this was my approach. And I went with this approach to the company to try, and my hypothesis, and to try to change this from service to product. But my wife said that will not happen and I will fail. So the next thing I done was I just sketched out the patterns that were visible internally in the product. So basically, uPacjenta and this kind of services have like two competing patterns, or maybe not competing, but rather coexisting patterns that are confusing from the product perspective. And what part is like booking system? So you just need to pick a specific date and an hour when someone will make a service or like service you, like Booksy, Dog Planner, or booking any kind of hotel booking services, etc. But on the other hand, there is a second part. So this in your place part. So things that you need to order something, you want to order something, and this thing will be done in your place, at your home, for example, or another specified by you place. So someone who is servicing you is coming to you. So like Uber, like Glovo, like Postmates, and stuff like that. So these two different, these patterns, we studied these patterns for a long time. As a user experience researchers, designers, product managers, we understand these patterns already because we saw how Uber done it, how Airbnb is doing this, and so on. But if you merge these two, you get something different, something confusing, especially for users. So this is like the fundamental problem, but on top of that, there are many different ones I found during like this first discovery. So for example, complex pricing based on location and cost of the tests and logistics of it. Like the complex offering, because we offer not only like individual tests, but also the whole packages, for example, for the whole families, or for athletes, or for women. Types of patients. For example, there is a difference between blood draw for newborns, children, and adults. Different specialists, they need to have a specific certification, for example, for for drawing the blood from newborns. There is also some additional UX problems, like you can order the blood draw for someone else in your family. For example, many times it was the most popular case, mother for their children. So you can have more than one patient. For example, someone is ordering tests for the whole family, for 4 people, for example. And that forced us to think in the multi-basket logic. So this is like a very big deal. And finally, data regulations, healthcare data regulations that are really strict. Meaning that, for example, we had lots of problems and difficulties with understanding and saving previous preferences of our clients without creating accounts or logins. So we couldn't, like for example, have sessions saved longer than few hours, comparing to not health data regulated services that can do it for days. So, what it meant? I counted that if you would like to complete the order, you need to at least 26 steps. So, actions to actually do it. And during one of our discovery calls with one of our clients, she said that we were on the phone and screen sharing. She was screen sharing the screen with us. It took 45 minutes. It's crazy, considering how fast we are used to, like how we are used to using services like Uber or Glovo that is very, very convenient and fast. And we thought that this, or I thought that this is doomed. Like, I need to change so many things there that I didn't know if it's even possible. But on the other hand, I checked another part of our data that was available for me, and I found out that we have 98 NPS. How many of you works with NPS? I think lots of you, probably. Yeah. So you probably know what does it mean. Like, the top possible number for Net Promoter Score is 100. 98 means that across the board, almost everyone is fully committed and fully happy with our service. And when these people come back for the next blood draw, after the first service, they have 2 times higher conversion rate than returning users. And I thought maybe this is because they created account, it's easier for them, but no, there's no difference there, basically, because accounts, at the point I came to the organization, the accounts didn't give you much of saving your preferences. So this was the first what the F moment for me in this organization. I didn't understand what's going on, really. So what I'd done is I went back to this discussion with my wife, and I started to wondering, maybe I'm looking at the wrong thing. Maybe I'm looking for the, I'm checking the product data, product stats, but I need to understand what's going on in the service. And I went back to my experience, first-time experience with uPacjenta, and I tried to understand what was so incredible that I wrote this message to Konrad. It wasn't the ordering path. It wasn't like the number of tests that they have. But the thing that the nurse, the medical specialist that came to our place, where she had time for us, she was patient, she was smiling, it was in our place, in our kitchen. It wasn't stressful comparing to my previous experiences. So maybe the service there is the answer, not the product. And then, like, in totally different part of my life, I was reading a book about parenting, and I stumbled upon this woman and Laurie and Paul that was like describing this so-called transformative experience. And what is this transformative experience? Like, in case of our lives, for example, having children is a transformative experience. It means that if you do not have them and thinking about them, you want to prepare and think in the future and understand what it entails. What does it mean, really, to have them, and what will happen with me? And I can guarantee you that you will not expect what will happen. The experience after having it will be totally different than before that. So I thought maybe this is quite a way to describe what's going on here in my small area of product management, that maybe there is a similar situation that there is a part of the users who didn't use us, they went to the site, or even thought about it, or maybe check it out on the Instagram or somewhere, but actually didn't use it. They didn't have this experience in-house at their place. But after that, they have this transformative experience and they understand what's going on there. And the biggest problem here is that if you already use it and have this experience, it's really hard to describe it to someone before that experience. You can do it in words, but words hardly transfer experience and emotions. So my thinking was, okay, so we need to take this barrier, this first part of customer journey, and make it this first-time use easier, faster, and smooth. To push as much as possible people through this first experience to have like a bigger clientele. So what we done? Like similar, like normal stuff that product people do. We mapped order path. We make this first steps easier, faster geolocation, better search. We speed up the site and redesign the offering to make it more like humane, more understandable. And we just limited the number of input fields to make this number of actions lower. And it should work, right? Like it's a normal practice. But no. It didn't change. It didn't budge. We saw a little bit spiked in the first steps in the order path, but in the end, on the payment page, we saw a downward trajectory. In the end, the number of users, well, in the same way, like in the same pattern than previously. So this was the second what the fuck moment for me. What's going on there? So then I remember like one thing, one discussion I had with my CTO and one of my PMs, and I connected this in my mind with my previous experience in Pizza Portal. If you are Polish, you probably remember situation when Pizza Portal was fighting with Pyszne. Pyszne finally won this battle for the food ordering in Poland. But we have totally different approaches. We were, as Pizza Portal, very performance-driven, performance marketing-driven. Pyszne was creating brand. And I know that we had a better product. We have a better conversion, we know it. We have better visibility online, we have a faster site. Everything should be better, but Pyszne won. And I didn't understand why. And this discussion, many years later, regarding uPacjenta and why our conversion is not improving, connected with these previous times. And I understood that in this kind of situation, the conversion is in different place, not in your product, but before that. When the user is not yet your user because it's not registered in your analytics, it's not measurable yet, it's in the cloud of motivation, context, situational stuff that this user have in his mind. And in our case, it's someone who would like to have this blood draw at his house, but don't know yet how to do it, but already know that he's already convinced. And our product is just a way to do it. We just need to not fuck it up. But normally, we don't know it, because it's fuzzy, it's not measurable in the very specific, concrete, measurable way. We start measuring things maybe somewhere here when we have like first conversion from our marketing activities, But normally with product analytics somewhere here, when you see that like the first page, landing page, and the first actions of the users until the place with the thank you screen. And we think about this part as a conversion funnel. But the conversion, in my mind, started much earlier than that. So how to approach it to actually understand who is already converted and what the decision is made. So when we're thinking from the from marketing perspective, we're using the segmentation based on marketing needs. So this is such a demographic approach, meaning, for example, mother with small children, or older fit male manager in the big company in the big city, and stuff like that. But this do not give us enough information to actually understand what the user actually thinking, what is his motivations. It's only things that we see, this artificial, superficial thing at the top of this pyramid of information that we can get and use. So we decided to move into the behavioral segmentation. It was really hard because most of the tools that's making money for us, so marketing automation tools, all the panels, all the dashboards in the ad networks are basically based on this social demographical approach. But we try to move it into more general buckets. So not like 35-year-old mother, but rather a person who cannot go to the collection point because they have small children and maybe is afraid that something will happen and the child will pick up some kind of sickness. Or if we have 30-year-old fit male, maybe there are person who actually training for something, they need to understand what's going on with their blood. And this is, of course, anecdotal, but later we have this proof and confirmation in our data that these two specific segments are really there. But the difference is that we didn't focus on specific years or genders, but rather having this have this bigger buckets. We can fit into them different motivations without thinking about, is it a mother or father, is it male or female? It's just a person. But they have biological bodies and they have these needs and they can all be sick or need to find out what's going on with their health. And thanks to our product researcher, Ola, that was working with me, it also unlocked for us something new. That insight that changed everything for us in thinking about our users. So if you think about healthcare or health in general, most of the motivations that are normally connected to health is about fear. And normally even not a fear about my own health, but the health of someone around me, surrounding me, especially my closest family. And most of the healthcare solutions that can be marketed are done on the fear-based triggers. So check what's going on, do it before it's too late, and stuff like that. So what we done when we understood that this is the main trigger for most of our users, we wanted to be different, wanted to be proactive, and wanted to be connected with some more positive messaging. So we found out that there is another thing there. After lots and lots of interviews and continued discovery, we just sum it up as agency, empowerment. Meaning, we found out why this NPS is so high. It's not because someone is getting better results. It's not even because that these people are doing this at their own house. And it's not even about the stress. It's about control, about partnership, about that I can decide what, when, how, and who will do this test on me. And I can negotiate it with the system. Comparing to the previous situation, when I need to wait in some designated place for some nurse that is doing lots and lots blood draws before that. She has probably 7 or 8 minutes for me and my child. And if something will happen, for example, my daughter will be crying, she will be stressed, I will be stressed, nurse will be stressed, and she would like to hurry us up, and everything will fall apart. And this is the difference, because now I can just point out specific place and even the person who will do this test for me in the time that is good for me. And this is the agency and partnership part that make the whole difference, and the stark comparison between the previous experience and this one. So we figured it out, and everything looks fine. So why we're going so slowly? It didn't change anything, really. And I thought that maybe at this time we are in this specific point when everything will go fine. But no, of course not. There was a specific time when in the same time we were doing all these experiments and doing the discovery of our users, something was changing in the world. So you need to know that uPacjenta started in very convenient time. I can say that. It's controversial, but it's true. During the pandemic, lockdowns, and COVID-19. At some moment, they have like meteoric growth 10 times every year, because at some point they were the only service where you can privately draw the blood, because all of other healthcare establishment were focused on curing COVID and servicing sick people. But when COVID was going down, I mean, it was not going down, but the severity of the COVID was going down, something changed. People stopped thinking about this healthcare issue like before. They went back to different problems at hand. The COVID wasn't in their mind at the same level that previously. So it was like the next what the fuck moment for me. Everything was fine, but our product market fit were escaping from us. This is the first time I was experiencing a situation like that, where the product market fit was locked in place, looks like, and then it was escaping us. Even if we like doing everything that is possible, the market was changing. Yeah, so COVID lockdowns were here and were growing like crazy, and we're here. After the COVID, I don't know if you remember, it was like post-COVID inflation. It was also Russian aggression on Ukraine too, and we were there, like in the success in our minds, and we are getting lots of awards, startup awards, fastest growing company in the CEE, etc. But after this stage, after we get back to the office, we're thinking we are doomed. We have like 6 or 8 months, and we need to find out something, understand what's going on, and find a new engine of growth. So then I found out, of course, thanks to my wife, the framework that helped me think about that in the different way, more dynamic way. Most of the frameworks, product frameworks, are like static. They are based on the current situation that help you reimagine like the current puzzles, put them in different way to find a better way for the future. But Three Horizons works differently. I will not go into details here, but I can discuss it later. But basically, you think about waves. The current wave you are in, And the first horizon, this is your engine of growth that you know that will be deprecated, and then the ceiling here is already visible, and you cannot do anything to actually change it. The only way you can do it, or think you can do it, is to find out these pockets of the future and iterate it to find a new engine of growth somewhere in the future. And the second horizon, this is the most important one, but it's in the middle. It's basically incremental adjustments that can help you hop from one wave to the third wave and find some kind of bridge between these two. So I use this approach to find out some kind of product clarity. We used like betting markets, so all of our stakeholders got the poker chips, the same amount of poker chips, and they were voting with the chips on the features and this incremental improvements and things that can move us from this first wave to the third one. And also I need to mention attention peak. This is my favorite workshop tool to use. So if someone is going off the rails, we just squish it and it's very loud and everyone is going back to the topic. So what we found out in the end, basically, we understood that our current approach, I want easy on-demand blood draw at home, it's not enough. Like, it's very limiting. There's a limited number of people who actually want to do it in Poland, especially with rampant inflation and minimal savings. So we're looking for something else. And what we found out is that there's a different story too, bigger one, that I want to understand if I'm healthy or unhealthy. So, like boiling down to this thing that what I need to do with my results of my blood draw. Do I understand these results? If I'm in the good health or not? Should I do something about it? What is the next action there? So we found out, like in the product space, that the answer is we need to have a better results panel. So the place when you can see these results compared to the previous ones, and for example, order the next blood draw, or maybe some other service, like consultations, for example, with a specialist. So this was the thing that will close the gap and give us like the next touch point and the way to create this cooperation with our patient for the longer time, not only for just this specific blood draw that happens once every year, or maybe twice a year. So, next thing that happened there, after this discovery of my team, what's going on there in this area of results, blood results, it's crazy. Like, I didn't know it. Like, the world of medical labs is so messy. Like, if you saw this your blood results, you probably understand what I'm talking about. But some tests have numbers. Some are binary. Some are descriptive. Some they don't have any specific results because they are compared with some other thing. Norms that you can see are not effective because they are universal. It's not based on the age or biological gender or ethnicity or anything like that. You can get multiple documents about one specific blood draw, and sometimes you get just half of your results, and the second half will be next week. Crazy. And just look at that. Like, this is how blood results looks like right now, normally, if you do it. So what we done, we basically create an MVP very fast with three most important things in mind. Firstly, showing out-of-ordinary results first. Like, based on the norms, universal norms, something that is for the whole list of 30 or 40 different results. If something is out of ordinary, out of norm, we just put it in the top of the results. Something that you can easily miss if you saw this black and white photo before that. One consolidated PDF with all the results. Why? Because after our discussion with clients, with patients, they said to us that basically they are not going to the results page never, ever. They just make a screenshot and show it to the doctor. So what we done, we just give them the way that consolidate all the results in the way that it's easy to screenshot on the phone. And that's all. This is the first version. No history, no patterns, no diagrams, nothing like that. The second MVP is like showing the previous history, results, and managing your upcoming visits. And we added on top of that way to buy additional consultations with the medical specialist. And this created like the first, like the bridging this gap and this real touch point that help us to move our users from someone who just want to have the specific blood done, test done, into someone who would like to think about his health health in the future. So the third MVP is a secret story. I cannot talk about it. I think it will be ready soon. But going to the end of the presentation, now is the time. So if we've done all of that and finally found something that is working, it's time for new opening. So what happened next? So we have this panel, we have this dashboard with the results, and we went after different market with the better unit economics. So B2B, so the companies. So like I said before, this inflation, limited number of investment into private healthcare on one hand, and the second hand, some new trend that we didn't even understand and it wasn't on our radar yet then. Employee benefits and people who, like the HR departments who wanted to add something on top of this current benefits. And what they can do is basically add a health solution, something that is actually valuable for their employees. And this was crazy. Like it rose like something for the six first months when we started doing that. It was half of all of our revenues then. And on the other hand, like labs market looks like restaurants or taxis market before that. I see the same patterns. They are scattered. There is no universal way to get your results in the way that can be easily manipulated or aggregated into one place and visualized, and nothing that can put it in one place for easier management. So I think this will happen next. And from our Free Horizon approach, I cannot go into details, but looks like this will be the way to go in area of healthcare. So I started posting this. This talk is based on the very long read with my case study. I think 4 or 5 episodes. First one is already here. If you want to read it in English, you can do it. And that's all. Thank you very much.
Thank you so much, Marcin, for this insightful presentation. And do we have any questions in the room? Please. And we have a mic, so just give us a second. No, because we got folks online, so they need to hear you as well.
How do you ensure employee safety during their customer visit?
Sorry, I didn't hear.
How do you ensure that your employees are safe during their visit to the customers?
That the medical specialists are safe during the visit, or
yeah, when they visit the customers, like how do you make sure that they remain safe?
Yeah, it's after like many years of work with them. Well, basically starting with that every new employee in the company needs to go with the shadowing with the medical specialist, and we go to check out how this looks like. And we didn't have any specific problems yet, And it isn't like it isn't a situation that is dangerous for medical specialists. We didn't heard anything like that. So we didn't had we didn't stress about it yet. Plus, the medical specialists and nurses, especially in hospitals, are trained with the patients that can have any kind of problems like that. So, yeah, it wasn't an issue for us.
Thank you so much. And there was also another question here, please. Do you have a mic? No, we need a mic.
I just wanted to ask about the app. I just went on the website now, and the first thing which I've noticed that probably you only have the addresses available in big cities. So when I put my address, it came up that it's not available, please go to the point. So I think you are losing a big market because in a village where I live, the closest point to give blood sample is probably about 15, 20 kilometers away. You also mentioned, like you looked at the market, like mothers with children, they can also go to a point. And sometimes when you said that the first time you go through application, it's 45 minutes. So if it was me, even if I have difficulty to get there, I would prefer to go to the point and give blood on the way than going through the application 45 minutes.
Yeah.
I purposely went on it now to see, and what I like about it, it's you put the address straight away. How you said you can give the package, so the most popular packages are on the top. That's great. I can choose this. I can choose the address, but then I got lost because there is nothing available for the place where I live. Are you going to develop it in the future so it will be easier available in places where people maybe they may be not mobile? So for example, in my village, there are a lot of people who don't have cars, their children live far away, and they would probably use your app, maybe not by themselves, because if they are older, they won't be able to do it, but their family could order it for them, and it would be much easier.
Yeah, so we actually tested it out. At some point, we just even needed to shrink the area where we are working to the biggest cities in Poland only, top 10, I think. But before we have a very long tail of every city that I think it's up to more than 300,000 people, or even smaller than that. But the problem there was like the starting cost of having this base of even one nurse or medical specialist that is available for us for every day, even without any appointment on every hour. That creates lots of costs for us. And so we found out that the critical mass of supply and demand and equilibrium between them is easier to achieve in the bigger cities. There's part of my presentation that I omitted about going to the foreign markets, because we have also experience there that the starting cost of doing this is huge. It's really huge, especially with a blended product like that, when you have the physical part of it and digital. If you have only a digital part, it's easy to scale it up in different countries, in the foreign countries. But when you have this physical part of it, the starting costs to have this base of labs that are available for you, nurses, cars that can drove to this patient location, is quite a lot. So this is why we needed to scale it down, to focus on the markets that are deepest. Maybe this is the best word. Yeah. Yeah. Yes, we also done it like that. The issue there was it was really hard to have continuous and good quality of service there. But what we done, and this is what I talk about, the better unique economics in the B2B market. What does it mean really? It's that we are not going to the patients, but we are going to factories or big companies like Biedronka, for example, and we are doing the healthy days when one nurse is drawing blood for every employee in specific area for this company, and then the unique economics is better. In these cases, we are going to the places that we are normally not available.